Welcome to this comprehensive walkthrough of the Dexup DVT pump system, designed to help prevent deep vein thrombosis, a serious yet preventable condition in immobilized patients. What is DVT? Deep vein thrombosis, or DVT, occurs when a blood clot forms in the deep veins of the legs. This condition can block normal blood flow, leading to swelling, pain, skin discoloration, and, if untreated, life-threatening complications like pulmonary embolism. Why use a DVT pump? Without prophylaxis, DVT can cause venous hypertension, rupture of superficial veins, chronic swelling, and post-thrombotic syndrome, or PTS, which affects up to 60% of DVT patients within 2 years. Mechanical prophylaxis, such as intermittent pneumatic compression, IPC, via a DVT pump, has been clinically proven to reduce DVT risk, particularly in postoperative or immobile patients. Let's move on to unboxing. Your Dexup DVT pump kit includes quick start guide and user manual, medium-sized calf sleeves, the DVT pump unit with integrated power cable and dual-channel air hose. The pump is lightweight, bed-mountable, and includes integrated cable and hose management for clinical convenience. How to set up and use the DVT pump. Unwind the power cable and air hose from the back of the pump. Now open the hooks. Mount the pump securely to the bed rail using the provided hooks. Plug the power cable to the power source. Remove the sleeves from the packet. Connect both the sleeves to the hose pipe and ensure you hear the click sound. The sleeve wrapping shown is for demonstration only. In actual use, wrap directly on the patient's leg, below clothing. Ensure that the V shape of the sleeve comes on the calf. Now wrap the sleeves to each leg. Maintain to 2-3 fingers gap between the sleeve and leg. Turn on the button which is at the side of the pump. Long press the green colored start button on the display panel. Now after 3 to 5 seconds the pump will show green light auto confirming that both sleeves are well connected and properly inflated and deflated. Default pressure is set to 40 mercury. Now the pump will start its compression cycles. First it will inflate and deflate the left leg, and the same process will happen for the right leg. Inflation cycle duration is 12 to 14 seconds and deflation cycle duration is 14 to 16 seconds. So in 1 minute inflation-deflation happens alternatingly for both the legs. You can change pressure from 30 mercury to 60 mercury for calf sleeve and thigh sleeve from display panel buttons. Now let us see how to wrap thigh sleeve properly on your legs. Ensure that the V shape of the sleeve comes on the calf and back portion of thigh and hole at back of the knee. Now wrap the sleeves to each leg. Maintain to 2-3 fingers gap between the sleeve and leg. Now if you want to attach only single sleeve to pump, follow these steps. Before starting the pump, only attach one sleeve to the air hose pipe. Now wrap the sleeve to the leg. The pump will detect the single sleeve, show the green light on the display panel and start the compression cycle. This is all the information you need to install and operate the Dexup DVT pump properly. If you have any questions, you can email us on sales@dexup.in or call us on +91 738 530 4200.